Maxima is on sale for an unbeatable $25,995. These are our lowest prices of the year. Plus, if you currently lease a Nissan, let us show you how we can save you even more. The Bottom Line Sales Event with unbeatable deals only at Middletown Nissan on Route 3 and at MiddletownNissan.com.
Good morning, it's 8:24. Cold can kill. On average, hundreds of Americans die of hypothermia each year. But in today's health report, Tim Lammers shows us that in the right hands, the cold can be your best friend when you most need it.
22-year-olds aren't supposed to collapse.
She was just kind of laying there, gasping for air. Her body just went limp and she turned blue.
22-year-olds aren't supposed to die.
The doctors say that I was clinically dead for 14 minutes, and that's a pretty long time.
Last summer, an undiagnosed heart condition dropped Stephanie Lee while she was working at Wickham Park in Manchester, and only one person had the chance to save her, her coworker, Matt Lane.
The way she fell, she kind of landed on top of the bar. Luckily, Stephanie's phone was right there near the bar, so I grabbed that. Dialed 911, started doing chest compressions and breaths.
They had to paddle her a couple times to get any kind of rhythm. It was quite an ordeal.
Because of Matt and because of the paramedics, Stephanie's life was saved, and she was transported to Hartford Hospital right down there. But she wasn't out of the woods yet. In fact, not by a long shot. Because you see, once her heart started beating again, that's when she faced a whole different set of problems.
Now the swelling starts happening. The brain is inside a confined space that only allows so much swelling.
She was facing brain damage unless that swelling could be brought down.
People mention cooling.
Therapeutic hypothermia.
That's right, hypothermia. After all, cold stops swelling, so they chilled down her entire body.
They get 2 bags of ice saline that goes right into their body, and that's perfectly fine and safe. And also putting some ice packs on the patient, just to start the process. And what we have is a catheter that goes into the patient's leg and into one of the major blood vessels. Okay. And this catheter circulates cold saline through these 3 balloons, which the blood will run over. It takes about an hour, hour and a half to cool someone using this technology.
They bring your body temperature down to anywhere between 32 and 34 degrees Celsius.
Keep them there for 24 hours, and then slowly we warm them. We've done close to 200 patients so far, and we've had wonderful success.
So this is the device.
Stephanie now has a pacemaker and a second chance.
She couldn't even put into words how grateful she was.
Not everybody could have done what he did.
Everything had to happen exactly the way it needed to happen for her to be here, the way that she is.
I am forever thankful.
In Manchester, I'm Tim Lammers.